Ferris, thank you. One of the current controversial items in President Joe Biden's Build Back Better plan is paid family leave. It's even gotten Meghan Markle, Duchess of Sussex, chiming in for support, writing to House Democratic leaders that, quote, when paid leave is a right, we're creating a foundation that helps address mental health outcomes, healthcare costs, and economic strength at the starting line. Now, this comes as it's reported that Biden informed Democrats that the emerging legislation will only provide 4 weeks of paid leave benefits instead of the initial 12 weeks. Joining us now with more are Todd Maish, CEO of the Illinois Chamber of Commerce, and Brenda Reyes, Director of Training and Curriculum with Health Connect One. Thanks to you both for joining us. So, Brenda Reyes, let's start with you, please. What kind of parental leave currently exists for families?
Thank you. Thank you for having me. So I think that would vary depending on where we live in the country. But for the state of Illinois, currently there is no paid leave for parents. Most employers are, I wouldn't say at least following, but some communities may be aware of the MLA law, which requires unpaid leave for 12 weeks. So it's not currently paid in our state.
So you can take 12 weeks but not get paid. Otherwise, you're saying
Exactly.
unless it's the kind of thing that an employer implements, families don't have access to paid leave. So Todd Maish, Build Back Better originally called for 12 weeks of paid family leave. It's reportedly been reduced to 4 weeks. What do you think of this concept of paid family leave, and should businesses be responsible for employees being off for that long?
Surprisingly, I think the business community would be very open to a discussion as long as holistic about paid time off. But keep in mind, employers, not all of them across the board, because there's a difference between a Fortune 50 company and someone who's just getting started in a restaurant with 10 employees. They don't have the same resources, but we want them all to be successful. But there's paid sick leave, there's paid personal time off, paid vacation. So I think that the business community's biggest problem would be if we're just going to put this on top of all the existing benefits that are already there. And keep in mind, there are a lot of union contracts that have already been negotiated for a lot of this time off. And this could be a state mandate that simply puts more paid time off if it's not done correctly. So we don't know what this is at this point in time. It sounds like it's just another government mandate on small, medium businesses and businesses that have already negotiated a union contract.
Brenda, what do we know about how paid family leave benefits the family, particularly with regard to mental and physical health outcomes?
So that's an excellent question. We know that, for example, around lactation, breastfeeding, establishing a good supply of breast milk, human milk for babies, which is the best nutrition recommended for children. It's really the foundation of health that is recommended by the American Academy of Pediatrics. We know that for birthing parents who return to work before 6 weeks postpartum, they are 4 times more likely to either not establish breastfeeding or stop early. And we know the benefits of human milk are imperative for our communities, that really are the foundation for the health. So, you know, the reduced ear infection, diarrhea, sudden infant death syndrome, infant mortality, diabetes, but there's also benefits for that birthing parent, reduce in cervical, ovarian, breast cancer, heart disease, obesity, high blood pressure, cardiac problems, child development. So there are many benefits that children can have from that establishment and receiving human milk. So in addition to that, there's research on decreased postpartum depression too.
And Todd, what, outside of this, what, sort of access could families or should they have to paid leave when a new baby or a new child comes into the family? And how can businesses support that?
Sure. I think that our notion and most employers' notion is they want as much flexibility to go ahead and have a discussion with their employees and meet the needs of the organization and the fact that they have to be a profitable organization and decide what's best for them. So the issue we just discussed, very personal, sensitive, but why not allow employers and employees to make decisions for themselves as opposed to government mandates? So I think that that is the key point that we would make in a lot of areas, which is why not empower employees and employers to come together and decide for themselves what works best for their workplace, what works best for the employees' lives that they employ. So that is our general overarching position on these government mandates. Let people decide for themselves.
Now, Brenda, the intention has been that the cost of this would be covered by an increase in taxes on corporations, but some say that obviously that's going to be very expensive. What is your reaction to those who point to the cost as a reason for not implementing this?
So it costs us 13. If we were able to support as a nation lactation and access to human milk for babies for at least 6 months, 90%. For 6 months, we are talking about saving $13 billion, right? And in addition to that, that's not costing work productivity. We're not looking at work productivity. We're not looking at absenteeism. We're not looking at death, disease of children. So there are, and this is a public health issue that our communities can really because we know that it is mostly African American and Latinx workers who have no access to any form of paid leave.
Okay, and that's where we'll have to leave it. My thanks to Brenda Reyes and Todd Maish for joining us.
Thank you very much.
Thank you for having me.